Thank you, Mr. Chair. Good morning, Mr. Edwards. The title of this hearing is, quote, Examining the Growing Welfare State. And I actually have an article here which talks about cutting corporate welfare. You remember this article, right? And in this article it says, one ripe area for reform is corporate welfare, which a new Cato study estimates costs the federal budget $181 billion a year. That's what you said, right, in this article?
Absolutely.
And your study helpfully breaks down by age the number $181 billion by agency and program, right?
That's right.
Unfortunately, however, HCon Res 14, this is the Republican House budget resolution, does not use your study, believe it or not, to find savings. For example, you've identified subsidies to different corporations, but this particular budget resolution doesn't actually use your study or any study to cut those subsidies. You don't dispute that, right?
No, right. I think Congress should cut corporate welfare and low-income welfare.
Well, let me talk about corporate welfare for a second and what this particular budget resolution tries to do. HCon Res 14 targets social safety net programs. It directs the Energy and Commerce Committee, which oversees the Medicaid program, to cut $880 billion from its budget. You don't dispute that, right?
I haven't looked in detail, but I assume that's right.
Additionally, HCon Res 14 directs the Ag Committee, which oversees SNAP, to cut $230 billion from its budget. You don't dispute that, right?
Right.
When I was young, I relied on the food stamp program, which was the predecessor to SNAP, and it was critical for my family. And I believe that cutting food aid is just plain wrong. Let me turn to another topic. Dr. Carson, you said the following: Obamacare is really the worst thing that has happened in this nation since slavery. You don't dispute you said that, right, sir?
I don't dispute that.
Well, let's look at the facts. Obamacare is really the Affordable Care Act, or the ACA. In 2024, the government reported that over 65 million people have health insurance because of the ACA. You don't dispute that, right, sir?
What I am making a point in when I said that is that all of the socialists and the Marxists say that socialized medicine is the linchpin to providing socialism throughout the entire system. And that is a system that moves us much closer to socialized medicine.
Well, let me ask you this. The ACA prohibits health insurance companies from refusing coverage for pre-existing conditions. You don't dispute that, right?
I would have to have a little more context than you just gave.
Well, believe me, the ACA prohibits health insurance companies from refusing coverage for people with pre-existing conditions. It also allows children to stay on their parents' health plans until the age of 26. You know, it doesn't sound like the catastrophe that you paint it to be akin to slavery. On the contrary, the ACA isn't keeping people down, it's lifting people up. And I find your prior comments about Obamacare being the worst thing since slavery really appalling. Mr. Dattagupta, right now, according to Realtor.com, the U.S. has a shortage of nearly 4 million homes, causing a housing crisis, right?
Yes.
In addition, since Donald Trump took office, the Bureau of Labor Statistics found that price hikes for food have accelerated, correct?
Yes.
The Wall Street Journal also found that new Trump tariffs are expected to cost American households at least $2,100 annually. You don't dispute that, right?
I believe it's analysis from the budget lab at Yale, but yes.
The affordable housing crisis is squeezing families today, and these new tariffs will make everything from rent to groceries even more unaffordable, unfortunately. Let me turn to Dr. Carson. Dr. Carson, you did not live in public housing, right?
That's correct.
I spent part of my childhood in Section 8 housing. This is actually a picture of the public housing that I lived in. It gave my family the stability we needed to work, breathe, and build a new life, and my parents were actually married. My family story is not unique, sir. HUD found that for every year a woman spends in public housing as a teenager, she generated $925 additionally in adult earnings than someone with unsteady housing. You don't dispute that, right?
Well, the issue is not whether public housing is helpful or not. The issue is, are there things that we can do to improve the situation and to make people more likely to exit from public housing? Real success is the number of people we can get off of assistance, not how many we can put on it.
I agree with you 100%. I exited public housing, sir. My family exited public housing. We moved to Peoria, Illinois. We entered the middle class, and I sit before you as a United States Congressman.
And I
That is
applaud
the
that.
hallmark
That's
of a
good.
successful program.
That's good, but unfortunately,
Thank you, and I
that
yield
doesn't
back.
happen.